The first couple of days after surgery, you will be sore, you will be tired. However, you won't be bedbound or homebound. You're allowed to get out. You're allowed to do things. You might need help at home, however, with things like cooking, cleaning, or running errands. What about pain medicine and activity? Generally, it is important to take your pain medicine before becoming active. Remember that narcotics do make you sleepy and can decrease your reaction time and coordination. There are other medications that will not do so. Medications like ibuprofen, naproxen, which is otherwise known as Motrin, or Aleve. These can be taken before activities to diminish the amount of pain that you would otherwise experience and still allow you to get active and help you recover. It's important to recognize that your activity can be tailored to your comfort level. There is no danger in becoming active as long as you're not suffering with pain. Walking is probably the best exercise to help you recover from your recent surgery. It can be done almost anywhere. Walking outdoors is probably best. However, if the weather is bad, one can stay indoors and walk on a treadmill, or go to the local mall and walk there. It is to be expected that your walking will be a shorter distance than before. Your stamina won't be as much as it was prior to the surgery. You can tailor the distance or time walking based upon your strength and energy. I would rather you go out for 2 or 3 short walks per day than try to do one long walk. It is best to walk on a nice level surface as opposed to rough terrain. Your balance and core strength may not have recovered. When it comes to bicycle riding, I think it is best to at first use a stationary bicycle. In that way, one does not need to worry about city traffic or core strength to maintain balance. This will allow exercise that is an equal alternative to walking and can be easily done. Wait until you've regained strength before actually getting on a bike and heading outdoors in our city streets. Many homes and local gyms have other exercise equipment. These can easily be used. In general, however, I find at first walking on a treadmill or using a stationary bicycle is easier and puts less strain on the abdominal wall. Other kinds of exercise equipment, like stair-stepping equipment or elliptical trainers, do put more stress. I would ordinarily recommend you wait until you have tried bicycle riding and walking and feel comfortable with that before trying these other pieces of equipment. However, ordinarily, within 2 or 3 weeks after surgery, these kinds of exercises are safe. Again, comfort is the key. If you feel comfortable doing it, it is fine and it is safe. Swimming after surgery. Swimming in general is an excellent exercise. However, with your recent surgery, it's important to let your incisions heal first. Ordinarily, it takes about 2 weeks before it's safe to get into a pool. It might be best to ask your surgeon. However, after 2 weeks, assuming your incisions have healed, it is fine to begin swimming and using that as a good exercise to recover after surgery. When it comes to lifting after surgery, it is important to recognize that it is comfort that is the key. For some patients, they may only be able to lift up to 10 pounds without causing discomfort in their incisions. And yet for others, they may lift up to perhaps 25 pounds and be perfectly comfortable. It depends on your strength and the way you are lifting things. So again, it is comfort that guides you. In general, we say that between 10 and 25 pounds should be your maximal lifting. You might need to alter the way you lift things or change your activities in some way, but let comfort guide you. You were given an incentive spirometer to use in a hospital after your surgery. It is best to take this home with you and use it there as well. During the first week, or until you've regained your normal physical activity, it is best to use this a few times per day to exercise your lungs and help them expand. This can reduce the incidence of pulmonary problems or pneumonia after surgery. Driving after surgery. This largely depends on your recovery and need for narcotics. It is important to recognize that if you've taken narcotics within 8 hours of driving, you should not be driving. It's also important to realize that you must be able to put on a seatbelt safely, you must be able to get in and out of the car comfortably, and you must be alert. If you cannot do these things, you should not be driving. For some people, they might be able to drive as soon as 3 to 5 days after surgery, and for others, it could be up to a month. Thank you for choosing Legacy Health, and we are all hoping they will recover as soon as possible.